So, you're getting ready for Medicare in 2026. It can feel like a lot to figure out and fast. But don't you worry. In this quick guide, we're going to break down exactly what you need to know, nice and simple. I mean, let's be honest. When you hear about Part A, Part B, Part C, Part D, does your head start spinning? It's like trying to make sense of alphabet soup. It's totally normal to feel a little overwhelmed by it all. But you are definitely not alone in feeling that way. Our whole goal here is to cut right through that confusion and just make things clear. I promise by the time we're done, you'll have a much better handle on how this whole thing works. So let's dive in. Okay, let's start at the very beginning with the foundation of the whole system. We're talking about Original Medicare. This is the health insurance program that's run by the US government, and it's really built on two main parts. First up, you've got Part A. This is your hospital insurance. The easiest way to think about it is this. Part A is for when you're admitted to a facility. You know, for inpatient care at a hospital, a short stay in a skilled nursing facility, or for hospice care. And here's the best part. For almost everyone, Part A is premium free. That's because you or your spouse already paid for it through Medicare taxes while you are working. So what's the catch? Well, it's not really a catch, but there is a main cost to be aware of, and that's the deductible. For 2026, if you get admitted to the hospital, you'll pay a deductible of $1,736. That single payment covers your first 60 days in the hospital. It's really the key number to remember for Part A. All right, let's talk about the other half of Original Medicare, Part B. This is your medical insurance. Part B covers pretty much everything else. We're talking about your regular doctor visits, outpatient care, lab tests, things like flu shots, and even medical equipment like a walker or a wheelchair. Now, unlike Part A, Part B does have a monthly premium. For 2026, the standard amount is $202.90. Just keep in mind, if you have a higher income, your premium might be a bit more, but for most folks, this is the number to expect. And besides that monthly premium, there's also a once-a-year deductible for Part B. In 2026, that's set at $283. So once you've paid that amount out of pocket for your medical care during the year, Medicare kicks in. After that, you'll usually just pay 20% of the cost for most of your services. And here's what that looks like in the real world. Your official red, white, and blue Medicare card spells it right out for you. Hospital for Part A and medical for Part B. This little card is your key to using these fundamental benefits. Okay, so you've got your hospital and your medical coverage with A and B. Great. But what about your prescriptions? That is a huge piece of the puzzle, and it's so important that it gets its own separate part, Part D. Yep, Part D is your prescription drug coverage. Now, this part is optional, and you get it by signing up for a plan from a private insurance company. These companies are approved by Medicare, and their plans are what help you pay for your medications. And listen up, because this is a huge deal for 2026. There's a brand new hard cap on how much you'll spend out of pocket on drugs each year. That cap is $2,100. Once you've spent that much, you will pay $0 for your covered drugs for the rest of the year. That is a massive new protection for people. And there's another game changer, especially for folks with diabetes. The cost of insulin is now capped. For any insulin that's covered by your Part D plan, you will pay no more than $35 for a 1-month supply. And that's true all year long, even if you haven't met your deductible yet. All right, so far we've built a pretty solid plan, right? We have Original Medicare Parts A and B, and we've added a separate Part D plan for drugs. But there is another path you can take. Think of it as an all-in-one alternative, and it's called Medicare Advantage. These plans are also known as Part C. Basically, private insurance companies offer these plans, and they bundle everything together for you. You get your Part A hospital coverage, your Part B medical coverage, and in most cases, your Part D prescription drug coverage, all wrapped up into a single plan. Now, as with anything, Medicare Advantage plans have their pros and cons. On the plus side, they often include extra benefits that Original Medicare just doesn't cover, things like dental, vision, and hearing. They also have a yearly limit on your out-of-pocket costs, which is great. The main trade-off? You usually have to use doctors and hospitals that are in the plan's network. So this brings us to the big decision. It's the central choice that pretty much everyone new to Medicare has to make. There are two main paths you can go down for your healthcare coverage. So the question is, which path is the right one for you? Is it the freedom and flexibility you get with Original Medicare? Or is it the all-in-one structured approach of a Medicare Advantage plan? Let's put them side by side to really see the difference. This chart really lays it all out. Look at doctor choice. With Original Medicare, you can go to basically any doctor in the country that accepts Medicare. Huge flexibility. With an Advantage plan, you're typically sticking to a local network. For costs, Original Medicare has that 20% coinsurance with no annual limit, whereas Advantage plans have set copays and a yearly maximum on what you'll spend. And then you can see how drug coverage is a separate thing for Original Medicare, but it's usually built right into those Advantage plans, which also often throw in those extra benefits we talked about. Whew, we have covered a lot of ground, from the absolute basics of Medicare to the two big choices you have. So what's next? What do you actually do with all this information? Let's talk about that. First, and this is really important, please remember that this guide is just for educational purposes. This is not personalized advice because everyone's health and financial situation is completely unique. For official personalized help, these are the places to go, no question. Medicare.gov is the official website. It has everything. You can call the number on your screen, 1-800-MEDICARE, or you can get in touch with your local SHIP office. They offer free, unbiased counseling. These are absolutely your best resources for getting answers tailored to you. And that really brings us to our final thought. As you start to weigh all your options, I want you to ask yourself this. What's the most important thing for you when it comes to your healthcare? Is it having the freedom to choose any doctor you want? Is it the peace of mind that comes with a yearly spending cap? Or is it having those dental and vision benefits included? Really thinking about that will point you toward the best decision for your own health and your future.